So if you look at injury rates, typically you're seeing people 0 to 4 weeks, 4 weeks to say 16, and 16 and beyond. Where are most of your clients?
Probably in the middle.
Probably in the middle, in the 80%, right? In that 80 percentile, you're going to be dealing with less of the inflammatory component and more chronic, right? Or do you get people in the subacute like 2 to 4 weeks? No, not really. 4 weeks and on. Yeah. So you're in the chronic stage. So you're really going to be dealing with a couple really straightforward timelines. 2 to 4 weeks, 4 to 6 weeks, and 6 to 8 weeks. If you're not dealing with like a ligament tear or a significant strain, you're dealing with pain management. Your 3 timelines are going to be 2 to 4 weeks, 4 to 6 weeks, 6 to 8 weeks. Those are literally tissue healing guidelines. Like if we're talking about stages of actual healing, would you guys say 4 to 6, 4 to 6, 6 to 8, 10 to 12? For like ligament, maybe grade 1s, maybe some grade 2s, and normal soft tissue injury, generally. So then it becomes easy because all you have to know is what stage are you in. You're seeing people mainly in the chronic side. So your general timelines for pain management, maybe a strain, a soft tissue, and maybe a ligamentous. In general, this is probably your gold right here, is where you're seeing people the most, right? Now, you can expedite healing if they're seeing you and you're setting a plan of care. Most of the time, people stay in the stages because they continue to aggravate the one thing that like if it's with twisting, like I have pain with twisting, okay? Stop like twisting, stop picking up the baby like this, stop doing certain things, right? So that's why we say you got to give them a little bit of homework, because there's got to be some variable that is impacting not just the tightness in their back, but it's actually creating it. So not just relieving the tissue, but removing the stimulus that continues to create more tension or pressure. So you can expedite that if you alleviate the activity modification. With treatment, I'd say you're at 6 to 8 weeks. You don't remove the barriers, it's going to be very tough to get them better faster. Now, a lot of you guys are going to have like, oh, I fixed that one real quick. Good for you. Maybe it was just tissue. But ultimately, you got to find the factors that continue to create more pressure or strain across that.
So let's say it's a factor like law enforcement there, where the vest has so you can't remove it.
Yes.
So you have to pretty much stay in that maintenance.
Correct.
phase.
Correct. So you have correct or compensate. 2 ways to treat. There's only 2 ways to treat. Can you correct their job skills or anything else? No. So one thing is compensate. Great. But the thing you have to do is you've identified that. Do they know that? Do they expect that you're going to get them 100% better?
Not really.
But then that should be clear.
I think it is clear based on
Great.
conversation.
Okay, great. So I would say that right from the get-go. You may never be 100%, but I can keep you as close to that as possible. So you're going to compensate. So what you're going to do is, can they wear suspenders? Is one thing. That's a thing in law enforcement. Some agencies allow you to do that. Can you unload the belt? And that's actually realistic. Some people don't need the heavy stuff. They can reduce. Then you have people with small waists. The belt doesn't carry it all. If they're a larger individual, now they have more space. But that means they more load. So if they have a larger waist, they probably carry more just because they have more space for it. So you have to figure out, can you reduce the load? Can you add suspenders? Because you can't change the other part, right? Can you add in a lumbar roll in their car to create the gap, the space between the seat and the actual vest? All you're trying to do is find compensation ways. Because ultimately you're like, all right, well, I can't, what if it's job related? You can still reduce modifications. You just got to figure out what those are. And once you reduce that, then all you do it here is you reduce their pain, and then you just got to keep it. But you're right, 100%. So you're in here, but you can still keep them at low levels of pain, but identifying that you're not going to ever get them out of pain. It's part of their job. But what I can do is keep you high so that you can perform at your best. So how do you help them? It's one, get them out of pain, but then two, keep them out of pain is the real goal that you have. I think it's what we all have, because everyone's going to have it. Law enforcement, you will forever have pain, guaranteed. Just what it is. Look at somebody who's 50 years old who's been doing it for 20 years. I mean, it's just backache, knee pain. Does that help?
Yeah, it does.
Which part helped the most for like context of tissue healing guidelines?
Kind of like the category of it. To the 4, from the 6.
Yeah, that's easy to remember.
Space it,
Yeah, and then depends on how flared up they are. If they're chronic and they haven't had treatment before, and this is not improved for years, and they haven't tried anything, you might get them better faster. But if they tried multiple things and nothing has worked, this might be a longer time because no one's figured out the activities. Unless you're going to have surgery, this is your only way around it. You can get them strong, do everything else, but remove the stress factors, get them strong, get all the things opened up, and then maintain them, because they'll drop right back into it. It's natural. They're going to drop right back into that pain. Good?
Thank you.
Yeah. What are the questions? Good on that? All right. Case number 1.